Hi, this is Beth Ashcraft. I'm the physical therapist, the lead therapist for WebPT. I'm going to go over some of the highlights for documenting for physical therapy evaluation, reevaluation, and daily notes. First, when you log in, you'll see the screen, and you come up to the right-hand corner and search for your patient. All of our examples are going to be based on John Doe. He's our mock patient. You can put the child's, oops, not John, the name and search. And it's not going to find it. John Doe, there we go. Click on your patient. And we have the PT record sheet. I have examples of an initial evaluation, some daily notes, a cancel note, and the beginning of a re-examination, so you can see all the parts. We will start. I'm just going to highlight some things that we need for the evaluations. There is a detailed step-by-step instruction for completing each of these notes, but for today I'm just going to be going over some of the highlights, some of the things I want to make sure we have. So we are going to look at this re-examination. We will go over the basic information, the date of your examination. You want to make sure that your visit number is accurate. It should automatically populate it. If not, you need to make sure you are entering it in so that it reflects an accurate count of how many visits you have. There's the diagnosis, the treating diagnosis. I want to go down to injury onset date. That is typically the child's date of birth, unless there was a specific incident that started the need for therapy. For an initial evaluation or a re-examination, the primary chief of complaint should be something like developmental delay, at risk for developmental delay, or parents concerned that the child is not standing. This is our explanation of why the child is being referred to physical therapy. The next section is current functional limitations. It's just a brief description of what the limitations are, and you just click on the appropriate boxes. So moving around, specifically walking, and then walking on different surfaces. There's a text box so you can add more specific hills, or I don't know, whatever more specific you need to be, but keep it brief. Moving around, you can click on changing, maintaining body positions. They have difficulty standing. Next section, pain scale, we don't necessarily need. And then you can go down to history. This can be a little confusing, so I want to highlight, if you want to comment on something, you mark yes. It doesn't necessarily mean yes, they have a social history, but yes, we want to comment on that. This is where you can add DME. If their child has an unusual living arrangement or is in foster care, that would be under social history. Then you can come down to birth history. Were they premature? Yes. How many weeks? If there were complications, then you get a text box to describe. If they were in the NICU, there's a text box to describe. The rest is pretty self-explanatory. If they have a latex allergy, seizures, or any other precautions, if there's any medical history after discharge from the NICU, then you'll be using this medical history box. If there's some important imaging or diagnostic information, if there's medication to report, and then this bottom section is important goals. What are the parents' goals? It's always important that we have that information. Parents would like John to be able to walk. There's more social, emotional, if they have some behavioral problems, you can document it there. You don't, if it's not applicable, don't worry about it. Those are the important things for the subjective page. Moving on to the objective of your examination, we have a Sunny Days PT exam profile. I ask that you select that. It has removed all of the extra examination tests and really narrowed it down to what we need specific for our pediatric clients. If there is, a special circumstance where you need other tests that weren't included, you can scroll down here and add any test you would like in addition to what is included in the pediatric profile. You would just click on that test and add it using this little arrow button right there. Okay. So there's inspection, we have patient consent, yes, or parent consent, yes. The outcome measurement tool, that is the important one. You're going to click yes, and we want to do the P-body. P-body is required for all of the insurance kiddos. So, I'm sorry, so sensitive. So, for the P-body, you need to, if the child is under 12 months, you need to include the reflexes, the stationary, and the locomotion. Include the raw score, the standard score, the percentile ranking, their age equivalent, and you need to give them a rating. All of this information is available in the P-body manual on how to convert the raw scores to standard scores, to find the ranking, the percentile ranking, the rating, and the age equivalent. If the child is over 12 months, then you'll be doing stationary, locomotion, and object manipulation. That's the ball skills. Then you will be doing also the gross motor score. So it's the sum of the standard scores for whichever 3 tests you did for that child, a quotient score, a percentile ranking, and again the rating over here. So the next section is posture. You can choose to use the drop-down menu or the text box, whichever you prefer. The next section is gait analysis. Again, you can use the drop-down menu or the comment section. What I really wanted to talk about is the developmental skills. When you first open it up, it's a yes or no box. You're going to click yes. We're looking at developmental skills. For the child's age, you should be opening every skill that is appropriate for that age. So if the child is, let's say 16 months, we want to look at rolling, yes. We want to look at sitting, yes. We want to look at moving to sitting, crawling. In here, in these text boxes, you're going to describe how the child is doing that particular skill. If it's age appropriate, then write age appropriate. If it should be an age appropriate skill and they're not doing it, then you can write unable, or if they're doing a portion of the skill, you can write, rolling halfway to back and requires moderate assistance to complete the roll. In this section, you should be doing your functional movement analysis of how that skill is being done if it's not at an age-appropriate level, or if it is being done atypically. So like I said, for their age, every skill that they should be doing should be opened up and a comment should be in there of some sort. I ask that you don't need to comment on the skills that are OT or speech skills. You don't need to. If you feel like it's important to comment, you can, but the bare minimum, you just need to write on the PT skills. So here's some that I had already started for this child. Additional comment section. I would like for you, before I get to that, I realize that some things are not listed here that we still look at. For instance, stairs. There's nowhere really to comment on stairs. So in the walks alone section, and this is in the instructions, but I'm going to go over it, I would like for you to also include all walking skills. Can they walk forward? Can they walk backward? Can they walk sideways? Can they walk on different terrains? And stair negotiation. All of that information should be relayed in the walks alone box for whatever is age appropriate for that child. So then when we get down to the bottom of the developmental skills, in the additional comments box, I would like for you to include the ball skills that there's nowhere to talk about anywhere else. So include tossing, catching, and kicking the ball, which I did in this section.
I'll give you my.
Okay, so then moving on, range of motion. I chose to just use the text box to describe the range of motion limitations, but when you open it up, there can be a list of joint-specific options to comment on each joint if you so choose. It's not opening up for me because I already started it this way, but if you feel more comfortable marking each specific joint, that's fine, you can do that. Same with strength. When you open up the strength section, there's like muscle by muscle, and you can put the MMT score. Sometimes I find it hard to really assign an MMT score for kids, so I choose to write in the text box about core strength, functional strength. What are they doing in terms of force generation, eccentric control, endurance and sustaining position. So all of that can be in the strength section. Then the neurovascular is where we're going to comment on tone, whether it's hypo or hyper. The next section is special tests. This is where we're going to talk about balance and proprioception. You'll click yes to open up the balance section. Most of these balance tests are not appropriate for us, but what we want to get to is the comment section where we can talk about balance that we need to. You can talk about static and dynamic sitting balance or standing balance. Single leg balance. I have an example. I tried to include in my example all of that. but postural control, balance, all of that stuff can go in this comment section. I didn't use the next couple tests in my example, but there's also, under special tests, there is an option for a torticollis assessment. There's a gross motor skill section where it has prone, sitting, rolling. You can use that section for the really young kids or the kids that are very, very low level of function, and you can just use those sections to describe what they're doing in prone in more detail. What specifically are they doing in supine in more detail? It doesn't necessarily need to be done if you feel like you are repeating what you said in the developmental section above. But it's just an option for kids that don't quite fit the developmental section. That is it for the objective part. I'm going to go up to the assessment. Here you will put your assessment statement. This is my reassessment, not the initial, so you'll see on the right side there is the statements that I made from the initial evaluation, so you can make sure what you're writing makes sense to what you had from the initial evaluation. Parent education, if it's appropriate, if you gave some education at that visit, you can explain that. You want to rate the rehab potential, if there are any contraindications to therapy, and then provide a problem list. It's just a short, sweet problem list. And this will carry over from your initial evaluation to your daily notes, and then again to your re-evaluation. And then the goals. So you write a measurable goal, you mark if it's a short-term or a long-term goal, and then over here is a percentage of how much the goal is met and what progress is being made. If this is the initial evaluation, these probably all will be 0%. And then in the daily notes, you will be commenting on those goals each time. So you can spend some time reviewing the dummy evaluation to look over this if you so choose. The next section is plan. So you want to look at the frequency and choose appropriately 1 time a week. Duration, you can make it custom for 6 months, and begin plan as outlined. Excuse me. Then you click all of the procedures that you want to include in your treatment plan. Therapeutic exercise, range of motion. You can click or type in whatever you want. Therapeutic activity, whatever it may be.
Is there like a preference for like which one they prefer us going under? I usually do therapeutic activity just because I don't feel like at this stage we're doing it.
Yeah, so the question was, is there a preference for which procedures or CPT codes we're using? That is a good question. I think in my instructions I included a list, a description of the CPT codes. Really, therapeutic exercise is something more where you're specifically working on range of motion or a strength skill. If it is, I mean, the same activity could be billed under therapeutic exercise or therapeutic activity. I feel like if I'm working on a transition skill, I might use it as therapeutic activity. But, if I'm working on sit to stand. But if you're doing it for a strength purpose, then you could bill it under therapeutic exercise. It's just all on how you're perceiving and why you're doing that activity.
I just didn't know.
And then if you're actually using hands-on facilitation, then I would use it as a neuromuscular rehabilitation along with balance, sequencing, or coordination. So that was a good question. And I think it's very specific to each child and why you're doing each activity. After you finish your plan, you are going to go to billing, and you are going to include a daily note with your examination. So you're going to click that. So your instructions, progress patient and next visit. If there's something specific you want to add, you can type it in here. If there are precautions, you can include that there. So for the initial evaluation, you would click that. For reevaluation, you click here. And that's it. In the objective findings box, you can just put C re-examination or C initial evaluation. That's all you need to put in there. And then you will come down to the bottom, and you should have an option that says forward re-examination to, and there's a drop down, and you will choose my name, Beth Ashcraft. I will review it and finalize it for you. If there are any corrections that need to be made, I will email you through WebPT. I ask that once you make the corrections, you email me back to let me know that the report or the daily note is ready to be finalized, because I don't have any way of knowing when updates have been made once you've initially forwarded it to me. We're going to go back to patient records so I can go over a daily note real quick, and then we will be done. So if we are going to add a daily note, after our evaluation, you'll see it will upload the current complaint box is going to be our subjective statement for the daily note. And it will upload from your previous note each time, so you just change what needs to be changed. This was from my previous note. Again, you want to make sure that your visit number is accurately relaying the number of visits you've used. The current functional limitation you can change as needed. Once they can stand on their own, you can remove that and put it up on their prior level of function. So this is changes as the child changes. But aside from that, that's the only thing that needs to change during the daily note. If a medical history has changed, like a change in medication, or the child has seen a neurologist lately, you can add that in the medical history section. You can make that change there. In the objective section of your daily note, you want to look at first the CPT codes that you did for that day. This is going to serve as your super bill. We go down to the direct timed codes, and you will mark the corresponding units for each code. And as you mark that code, a text box or flow sheet box will open up, and in here you just list the activities you did underneath that CPT code. So jumping, stepping up and down. For neuromuscular education, we did balance work. We worked on single leg balance. And therapeutic activity, walking, running on an even surface. I do want you to be aware of what CPT codes you're using. Some insurances are very particular on what CPT codes they will approve. If there is a limitation of CPT codes that you are needing to follow, it will be in the additional information section right here. It will list the approved CPT codes for that particular child's insurance. So you need to make sure what you are choosing is an approved code for that child, or we will not get reimbursed for those activities you performed. In the objective findings box, I'm going to import from the last one. This is where you're going to write a more of descriptive of what you did in the treatment session. We want to look for the measurable information, the level of assist, the number of repetitions, I don't know, anything, how many seconds they were sustaining a position, percentage of success. That is what should be in the objective findings section. It doesn't necessarily have to be as wordy as this. I was just trying to give an example of everything that could possibly be written in there. The assessment is your assessment of that treatment session for today. So again, there has the information from our previous daily note, but just your assessment of what is going on. Again, parent education, if you gave any education, you can document that. The problem list automatically gets pulled from your evaluation, so you don't have to fill that out. What I want to go over is the goals now. Each session, if there has been progress towards the goal, then you need to document that in this section here by changing the percentage and including, if you're changing the percentage of what was done, then you need to document in the text box what progress was made to justify that percentage change. It doesn't have to be super detailed for stepping up and down the curb without assistance. You could just put requires min assistance at this time. I do ask that as you meet the goals, and the goal is met at 100%, you leave it, don't remove it, do not remove the goal. The goals that have been met need to be retained through every daily note so that when you make the next reevaluation, you will have a list of all the goals that have been met. If you remove it, then it's gone and there's no way to track the progress. So in your subsequent reevaluation, you will have a whole list of the previous goals, some at 100%, maybe not all of them were met. Comment appropriately, and then you will make new goals. So your reevaluation may have a very long goal section. It will show goals that were met previously and then include your new goals. When you do your next daily note after that, you can remove all of the old goals that have already been met. But for the sake of each daily note, leave all the goals. Then we will go to the assessment or the plan section. For the daily note, just needs to be very simple, progress towards the next visit. This particular note said complete re-exam next visit, but you can write stuff like, continue floor mobility skills or continue strengthening activities for core and lower extremities. Or you don't even need to write anything if you don't want to, but you just need to make sure that you make an appropriate plan. And again, for you guys, you'll have a box right here that will say forward to that. I think I said I have included in the instructions is a list of the most common CPT codes and a description of generally what is included, what activities are included in that CPT code. If you have any questions, please feel free to email me or give me a call. Does anyone in the room have questions?
I do, but I don't know if you need to keep on. But when you said the part about someone who's low level, I think you were in the developmental part.
Yes.
Can you go over that again?
Yes.
It's the little girl that I was having trouble with the Peabody.
Yeah.
She's going to score so low.
So unfortunately, the question was about the difference between the developmental skills and the gross motor skills section in the
Yeah, well, you touched on a
explanation.
place to
Yeah, so
describe a little girl like that.
in my example documentation, I made it so that I was talking in the developmental skills.
Okay.
So let me pull open the re-examination.
Yeah, no,
Does
but
that
I
make
have
sense?
one too that
Yeah.
was like that,
Because
and
the Peabody score is going to be very low. And I feel like I need to justify PT for her, but it's developmentally, it's not going to look good. Function-wise, it's not going to look good either.
Maybe we'll
But-
talk about this off camera because it's specific
Yes.
to that. But what am I doing?
maybe just show where.
Yeah.
Yeah, and
I'll show
if
where
you
it's
could just
at.
show which area. that
Well,
would be
but
great.
it's not. It doesn't open online because I didn't comment on it.
Oh, like you saved this or whatever.
Maybe if I. Okay, for the sake, I'm going to. We're going to open up a new examination form. Okay, so the question was. So under observation, we have the developmental skills, and that's all of these skills here.
So on this
But-
particular child,
If you have a child that is either very young or is very low functioning, that all of these are just not even appropriate to
Right.
discuss, you will go to, instead of commenting on developmental skills, you're not going to do that section. You're going to come down to the special tests, and you're going to go to gross motor skills. So now
okay,
you can open up prone
and describe it.
and you can describe what they're doing in prone. This gives a lot more detail. So again, for younger children or very low level functioning children, this is what you're going to use instead of the developmental skill section. So you can click multiple drop down items, or I always find this is more helpful, but this is just me. You can go to custom and you have a text box and you can describe what that child is doing specifically in prone.
Okay, perfect.
Okay, and
Yeah, that
same for all of these developmental positions: sitting, rolling, supine, standing. So you don't need to do both sections, gross motor and developmental skills. Just pick whichever one most accurately describes the child for you. And you want to be thinking in terms of, the help gross motor strands that we're doing. You want to make sure you're accurately describing what the child can do and how they're doing it. So not only what, but how,
Yep.
because that's really what we're trying to change, is how they're doing things if it's atypical. So you need to make sure that all of that information is accurately described in your note. So it's up to you to determine where that best fits, case by case. But that is the difference between gross motor and the developmental skills, because there is some overlap, and I don't want you guys to do duplicate work. Just find the best place to record that. So that was a good question.
Thank you.
And like I said, if you have a case-specific question that you don't feel like was accurately answered in this training, feel free to email me or give me a call. Thank you.